There are 9 symptoms of multiple sclerosis that you should be aware of. Greetings, viewers. Multiple sclerosis, or MS, is a disease in which the central nervous system is damaged. System. This causes damage to both the nerve fibers and the covering that surrounds them. As a result, messages between your brain, spinal cord, and the rest of your body are disrupted. Haywire. One of the most prevalent MS symptoms is fatigue. In today's video, we'll go over 9 unexpected indications and symptoms of multiple sclerosis. Is it possible for it to cause vertigo and speech problems? What about difficulties with your skin and hearing? We'll cover everything from symptoms to treatment and diagnosis, as well as a lot more. 1. Vertigo. Fatigue, difficulty walking, and numbness are the most frequent MS symptoms. You may also suffer from dizziness, bladder and bowel problems, and depression. Intimacy difficulties and eyesight impairment are 2 other MS symptoms. There are a few symptoms that are less common but are nevertheless linked to the condition. Vertigo is one of them. You may have dizziness and lightheadedness if you have this condition. However, if you have vertigo, it will feel as if the world is whirling around you. This is linked to the formation of brain lesions in an area of the brain that governs and coordinates your balance. Motion sickness medications are one technique to manage vertigo, but they only provide temporary relief. A brief reprieve. That isn't beneficial in the case of a chronic illness. If you've recently developed vertigo, your doctor will prescribe a particular prescription. Have you ever experienced dizziness when traveling? Have you ever experienced motion sickness? What did you do in order to feel better? Please share your experiences with the best health community in the comments section below. 2. Speech impediments. According to research, 25% to 40% of MS patients experience speech problems. This is due to lesions in various areas of your brain. This is more common in the later stages of MS. There are various types of speech impairments to watch out for, such as when the speech is slurred. The pattern is changed. You could possibly be slurring because your mouth muscles and tongue are out of sync. Stuttering is another speech problem you could encounter. You might also notice a reduction in the volume of your speaking. 3. Swallowing problems. It will be more difficult to swallow if you have MS in its latter stages. Damage to the nerves that control the muscles in your mouth and jaw causes this. Throat. It could also be caused by numbness in your mouth or medication-induced dryness. It's a major concern if you're having trouble swallowing. To eat and drink safely, you'll need to undertake some exercises. To deal with the problem, you may need to make some dietary changes. 4. Itching. Damage to the nerves in your central nervous system that control feeling causes this. System. You will still be itching even though no irritant is evident as a result of this. Skin creams and other over-the-counter itch relievers will not work because the itch is not caused by a virus. Bug bites or rashes are the most common causes of itching. Instead, you may need to see a doctor and take anti-seizure or antidepressant drugs, in addition to cognitive behavioral treatment. 5. Hearing issues. Approximately 6% of persons with multiple sclerosis also have hearing problems. Hearing loss, on the other hand, is a very uncommon early symptom. Hearing loss can occur for a variety of reasons, one of which being nerve injury in the pathways. The brainstem and the brain. You don't have to worry about permanent hearing loss because it usually improves with time. Hearing loss isn't very prevalent in people with MS. 6. Tremors. Tremors are one of the most common symptoms linked with multiple sclerosis. Involuntary shaking of various bodily parts is referred to as this. Tremors are caused by nerve injury that helps you coordinate your motions. The intention tremor is the most common of the various types of tremors you may encounter. The most popular type. It occurs when you are attempting to grasp an object or reach for something. It might also happen while you're trying to move your hands or feet to a precise position. Place. Tremors make it difficult to carry out daily chores. You'll have difficulty getting dressed and even performing basic things such as eating and drinking. Drinking. There is no effective treatment for tremors, however physical therapy can help to assist with the trembling. 7. Migraine and headache. A headache was not previously recognized as a symptom of multiple sclerosis. However, an in-depth examination of 16 studies revealed that headaches are, in fact, common. In reality, it's a symptom of the condition. More than 3,500 people with multiple sclerosis took part in these investigations, with more than half of them surviving. They were both suffering from headaches. Along with these findings, 27% of the patients suffered from headaches, whereas roughly 10% of the participants did not. Tension headaches plagued them. Cortical or brainstem lesions have been reported to be the cause of MS headaches in several investigations. 8. Breathing difficulties. Damage to your chest muscles is a major issue when you have multiple sclerosis. You'll find it difficult to breathe if you have problems with the nerves that regulate your chest muscles. To even properly breathe. It's a problem that can deteriorate with time. This issue will be more demanding if you already suffer from weariness. To solve the problem, try completing breathing exercises. However, in order to avoid further difficulties, thorough diagnosis and treatment are required. 9. Taste and olfactory loss. A change in the way your food smells or tastes is another sign of MS. According to research, a significant number of MS patients had difficulty figuring out what was wrong with them. Sweet, sour, salty, and bitter are the 4 basic tastes. The cause of this loss of taste has been related to lesions across the brain. While not common, some MS patients have described the polar opposite reaction, a feeling of hopelessness. Heightened olfactory and gustatory perceptions. It's a bit of a gamble. MS is a diagnosis of multiple sclerosis. Multiple sclerosis does not have a definitive test. After eliminating out other illnesses, a simple MS diagnosis is made. Your doctor will likely ask for your complete medical history and run you through a series of tests. A medical assessment. You'll almost certainly go through the following. Test of the blood. Other disorders with comparable symptoms can be ruled out using blood tests. These blood tests can also be used to check for biomarkers linked to multiple sclerosis. This is really useful for your diagnosis. Spinal tap is a video game that is based on. Spinal taps, also known as lumbar punctures, are performed to extract a tiny sample of fluid from the spine. Your vertebral canal. It's then transported to a lab for testing. If the sample reveals anomalies and antibodies linked to this condition, you're most likely to be diagnosed with it. Multiple sclerosis, MS, is a disease that affects people of all ages. Lumbar puncture can also be used to rule out diseases and infections that have similar symptoms. Disease. MRI. Resonance in magnetic fields imaging is performed to determine if your brain has any lesions. Or the vertebral column. If there are any lesions, they are examined to see if they are related to multiple sclerosis. Areas. An intravenous injection is usually used to do an MRI. A contrast substance is used in the injection to highlight lesions. This will determine whether or not your condition is active. Potential testing elicited. The electrical impulses produced by your nervous system are recorded during evoked potential examinations. In reaction to a variety of stimuli. You may be exposed to visual or electrical stimuli throughout these examinations. During a test, you'll be required to watch a moving visual pattern or a brief electrical discharge. Nerves in your legs and arms will be stimulated. The speed with which information travels down your nerve pathways is measured by electrodes. Treatment. This disease has no definitive treatment. Treatment for multiple sclerosis focuses on managing your symptoms and reducing the course of the disease. A better understanding of the disease and how to recover from assaults. Plasma exchange is a common treatment for multiple sclerosis attacks. Medications will almost certainly be prescribed by your doctor. These are medications that are used to treat nerve irritation. The liquid part of your blood is taken and separated from your blood during plasma exchange. Cells. After that, the blood cells are combined with a protein solution and returned to your body. When alternative therapies fail to work, plasma exchange is used. Treatment to reduce the rate of aging. Medication and therapy are used to help with MS progression. To avoid a relapse, numerous disease-modifying treatments are available. Multiple sclerosis is a difficult disease to deal with. It has an impact on the brain, spinal cord, and nerves. While the sickness isn't completely curable, you can still manage the symptoms by following the steps below. Follow your doctor's instructions. A healthy diet that promotes brain health is an excellent place to start. Check out the 9 best foods for improving memory and brain function. Or how about the 11 worst brain foods? Go ahead and select one. Or, even better, watch both and take care of your mind. Do you know someone who suffers from multiple sclerosis? Please let us know in the comments section below.